What if I told you that a medication sitting in your bathroom cabinet right now could steal your vision while you sleep? I'm not talking about some rare tropical disease or a freak accident. I'm talking about a common drug that millions of older adults take every single day, completely unaware of the silent damage happening behind their eyes. My name is Dr. Sarah Mitchell, and I've been an ophthalmologist for over 15 years. In that time, I've seen dozens of patients walk into my office with the same devastating story. Doc, I woke up yesterday and half my vision was just gone. And when I ask them what medications they're taking, the same culprit shows up again and again. Here's what terrifies me most. This isn't just about losing your ability to read or drive. Vision loss in older adults is directly linked to deadly falls, isolation, depression, and even early death. Studies show that seniors who lose their vision are 3 times more likely to suffer a hip fracture within the next year. And hip fractures? They're a death sentence for 30% of older adults within 12 months. But here's the good news. If you catch this early, the damage can be stopped. And if you've never taken this drug, knowing what it is could save your sight for decades to come. Stay with me until the end, because I'm going to reveal the hidden mistake most doctors make when prescribing this medication. A mistake that's costing people their vision every single day. Alright, let me start with the drug that's probably sitting in your medicine cabinet right now, and you have no idea it's slowly stealing your vision. Let me tell you about Margaret. She's 68. A retired teacher who spent 30 years shaping young minds. She loves gardening, volunteers at her church, and never missed a day taking care of her health. Last year, her doctor prescribed prednisone for severe joint inflammation in her hands. It was a miracle at first. The pain vanished. She could garden again. She felt like herself. But within 6 months, something started to go terribly wrong. Margaret walked into my office in tears. "Dr. Mitchell," she said, "everything looks like I'm staring through a foggy window. I can't read my recipes anymore. I can't see my grandkids' faces clearly." When I examined her eyes, my heart sank. She had advanced cataracts. Her lenses were cloudy and thick. Worse, her eye pressure was dangerously high at 32 millimeters of mercury. Normal is between 12 and 15. Margaret was showing early signs of glaucoma. The drug that caused this? Corticosteroids. Now before you panic, let me explain. Corticosteroids drugs like prednisone, phenylprednisone, and methylprednisone absolute miracle drugs. They save lives every single day. Doctors prescribe them millions of times every year for inflammation, autoimmune diseases like lupus and rheumatoid arthritis, severe allergies, asthma attacks, and chronic pain conditions. If you've ever had a serious flare-up of inflammation, corticosteroids probably rescued you. But here's what most patients never hear: long-term use of corticosteroids, we're talking more than a few weeks, can quietly destroy your vision in 2 deadly ways. And the tragedy is, most people don't find out until the damage is already done. Let me break down what's happening inside your eyes. First, corticosteroids accelerate cataract formation. Your eye's lens sits right behind your pupil. It's supposed to be crystal clear like a camera lens, so light can pass through and create a sharp image on your retina. Corticosteroids mess with the proteins inside that lens. These proteins start to clump together like scrambled eggs in a hot pan. Over time, the lens turns cloudy and thick. That's a cataract. Now here's why this happens faster in older adults. When you're young, your body has repair systems that can fix damaged proteins and keep your lens clear. But as you age, those repair systems slow down. Your body can't keep up. Add corticosteroids into the mix, and it's like pouring gasoline on a fire. The cloudiness accelerates. What might take 20 years to develop naturally can happen in just 6 months on high-dose steroids. I've seen patients in their 50s and 60s develop cataracts so severe they needed surgery within a year of starting prednisone. And here's the kicker. Once the cataract forms, your vision doesn't just get a little blurry. Colors fade. Bright lights create halos and glare. Night driving becomes impossible. Reading becomes exhausting. Your independence starts to slip away. Second, corticosteroids raise the pressure inside your eye. Let me give you an analogy. Think of your eye like a water balloon. Inside your eye, there's a clear fluid called aqueous humor that's constantly being produced and drained. It flows in, circulates around, and then drains out through tiny channels in the front of your eye. This keeps the pressure stable. Corticosteroids block that drainage system. They cause the channels to get clogged, like a sink drain filled with hair. The fluid keeps being produced, but it can't escape. Pressure builds. And builds. And builds. Here's why that's so dangerous. Your optic nerve, the cable that connects your eye to your brain, is incredibly fragile. It's made up of over 1 million tiny nerve fibers bundled together. When the pressure inside your eye gets too high, it starts crushing those nerve fibers. One by one, they die. And once a nerve fiber dies, it's gone forever. That's glaucoma. The scariest part? You won't feel it happening. There's no pain. No warning. No red flags. Glaucoma is called the silent thief of sight for a reason. You might not notice anything wrong until you've already lost 40% of your vision. By the time you realize something's off, maybe you bump into things on your left side, or you can't see cars in your peripheral vision. The damage is permanent. According to research published in JAMA Ophthalmology, patients taking oral corticosteroids for more than 3 months have nearly double the risk of developing glaucoma compared to those who don't take steroids. And the longer you take them, the higher the risk climbs. Now here's what you need to do. If you're taking corticosteroids, whether it's prednisone for arthritis, dexamethasone for an autoimmune condition, or any other steroid for more than a few weeks, you need regular eye pressure checks every 3 to 6 months. This isn't optional. This is life or death for your vision. Most doctors who prescribe corticosteroids are focused on the condition they're treating, the inflamed joints, the lung disease, the skin condition. They're brilliant at what they do. But many of them don't mention the eye risks. It's not because they don't care. It's because in our fragmented healthcare system, everyone's focused on their specialty. The rheumatologist focuses on your joints. The pulmonologist focuses on your lungs. But no one's looking at your eyes. So you have to advocate for yourself. Ask your doctor, do I need to see an eye specialist while I'm on this medication? Get your eye pressure checked. If it's elevated, there are eye drops that can bring it back down before permanent damage occurs. Catching it early is everything. Margaret's story has a hopeful ending. We caught her glaucoma before she lost significant vision. We started her on pressure-lowering eye drops, and her eye pressure came down to a safe level. She eventually had cataract surgery, and today, her vision is better than it's been in years. But she was lucky. Many patients aren't. But corticosteroids aren't the only drug lurking in your medicine cabinet that can steal your sight. The next medication I'm going to tell you about is even more common, and the blindness it causes can happen in a single night. Now here's the drug category that shocked even me when I first learned about it in medical school. And I'll bet your cardiologist never warned you about this risk. Certain blood pressure medications can actually cut off blood flow to your optic nerve, causing what we call a stroke in your eye. And unlike a regular stroke that might give you warning signs like numbness or slurred speech, this one happens silently while you're sleeping. You go to bed seeing perfectly fine. You wake up and half your vision is just gone. Let me tell you about Robert. He's 71, a retired construction foreman. Strong as an ox his whole life. Never had major health problems until his doctor diagnosed him with high blood pressure 3 years ago. They put him on a calcium channel blocker, amlodipine, and told him to take it every night before bed. His blood pressure came down beautifully. Everything seemed perfect. Then one Tuesday morning, Robert woke up and couldn't see out of his right eye. Not blurry, not foggy, just a massive dark spot right in the center of his vision, like someone had painted over half the world with black ink. He rushed to the emergency room, terrified he was having a stroke. When they examined him, they found something called non-arteritic anterior ischemic optic neuropathy, NAN for short. His optic nerve had been starved of blood overnight. The damage was permanent. Here's what happened, and why you need to understand this. Your optic nerve is like a garden hose carrying water to your lawn. But instead of water, it's carrying blood rich with oxygen and nutrients that keep the nerve tissue alive. That nerve is incredibly delicate. It has over 1 million nerve fibers packed together, all working to transmit the images from your retina to your brain. If that blood flow gets interrupted, even for just 4 to 6 hours, those nerve fibers start dying. And once they're dead, they don't come back. This condition, ischemic optic neuropathy, is one of the leading causes of sudden, permanent vision loss in adults over 50. And here's the terrifying part. It's often linked to blood pressure medications. Now, before you panic and throw out your pills, let me be very clear. These medications save lives. Calcium channel blockers and beta blockers prevent heart attacks and strokes. They've saved millions of people from dying. I'm not telling you to stop taking them, but I am telling you that you need to understand the risk and how to protect yourself. The medications most linked to this are calcium channel blockers like amlodipine, nifedipine, and diltiazem, as well as certain beta blockers like atenolol and metoprolol. These drugs work by relaxing your blood vessels and slowing your heart rate, which lowers your blood pressure. That's exactly what they're supposed to do. But here's the problem. In some older adults, especially those who already have risk factors like diabetes, high cholesterol, or sleep apnea, these medications can drop blood pressure too low at night while you're sleeping. Your heart slows down. Your blood vessels relax. Your blood pressure dips. And when it dips too low, your eyes don't get enough blood. Think about it like this. Your brain and your heart have backup systems. If blood flow drops a little, they can compensate. They have reserves. But your optic nerve? It's running on a razor-thin margin. There's almost no backup. It's like a power grid with no battery. If the electricity cuts out for even a few hours, everything shuts down. When your blood pressure drops too low at night, and we're talking about systolic, pressure dropping below 90 or 100, the tiny blood vessels feeding your optic nerve can't deliver enough oxygen. The nerve tissue starts suffocating. And by the time you wake up, the damage is done. You've had what we call an eye stroke. Here's what the research shows. A study published in the British Journal of Ophthalmology found that people taking blood pressure medications at night, especially calcium channel blockers, had a significantly higher risk of waking up with sudden vision loss compared to those who took their medications in the morning. The difference? Timing. When you take your medication in the morning, your blood pressure dips during the day when you're awake and active. Your body compensates. But when you take it at night, your blood pressure dips during sleep, when your body's cardiovascular system is already slowed down. That's when the optic nerve is most vulnerable. And here's the part that makes my blood boil. Most cardiologists never mention this. They prescribe the medication. They tell you to take it at bedtime because it's convenient. And they never warn you about the eye risk. It's not because they're bad doctors. It's because they're focused on your heart. They're thinking about preventing heart attacks and strokes. But they're not thinking about your optic nerve. So here's what you need to do right now. If you're taking blood pressure medication at night, especially calcium channel blockers or beta blockers, talk to your doctor about switching to a morning dose. This one simple change could save your vision. And if your doctor asks why, Tell them you're worried about nocturnal hypotension, low blood pressure at night, and it's linked to ischemic optic neuropathy. Use those exact words. They'll know what you're talking about. And here's the second thing. If you've ever woken up with sudden vision changes, even if it cleared up after a few minutes or hours, get to an eye doctor immediately. What feels like a mini problem could be a warning sign. It could be a transient ischemic attack in your eye, like a mini stroke. And just like mini strokes in your brain, they're often a warning that a bigger one is coming. Robert's story doesn't have a happy ending. His vision loss was permanent. But if he had known about this risk, if he had taken his medication in the morning instead of at night, he might still have full vision today. But here's where it gets even more frightening. There's another class of drugs, ones you can buy without a prescription, ones sitting in your medicine cabinet right now, that can trigger sudden blindness in a matter of hours. And most people have no idea they're at risk. Alright, now we're getting into territory that most people would never suspect. This next category includes drugs you can buy at any gas station, any pharmacy, without a prescription. Drugs you probably have in your medicine cabinet right now. And for certain people, these drugs can trigger sudden, agonizing blindness in a matter of hours. This one blindsided me early in my career, and I'll never forget it. It was a Saturday night. A 62-year-old man named David came rushing into the emergency room, clutching his right eye, doubled over in pain. "Doc, something's wrong," he gasped. "My eye feels like it's going to explode. I can barely see." His eye was red, rock hard to the touch, and his vision was cloudy, like he was looking through wax paper. He was in absolute agony. I asked him what happened. He told me he'd taken 2 Benadryl tablets the night before because his seasonal allergies were flaring up. Just regular over-the-counter Benadryl. Nothing unusual. He went to bed feeling fine. But when he woke up at 3 a.m., his eye was throbbing with pain so intense he thought he was having an aneurysm. When I examined him, my heart dropped. His eye pressure was 58 millimeters of mercury. Normal is 12 to 15. His drainage angle, the tiny channel where fluid escapes from the eye, was completely blocked. David had acute angle closure glaucoma, one of the most terrifying medical emergencies in ophthalmology. If we didn't act fast within 12 to 24 hours, his optic nerve would die, and he'd be permanently blind in that eye. The trigger? Anticholinergic drugs. Now I know that's a complicated word, so let me break it down. Anticholinergic drugs block a chemical in your body called acetylcholine, which controls things like muscle contractions, saliva production, and pupil size. These drugs are everywhere. And I mean everywhere. Over-the-counter medications like Benadryl, diphenhydramine, Dramamine for motion sickness, and Unisom for sleep are all anticholinergics. Prescription drugs like certain antidepressants, especially older ones, like amitriptyline and nortriptyline, are anticholinergics. Bladder control medications like oxybutynin and tolterodine, anticholinergics. Even some anti-nausea pills and antihistamines fall into this category. Millions of older adults take these medications every single day without knowing they're at risk. And here's the terrifying part. For people with a certain eye anatomy, these drugs can trigger sudden blindness overnight. Let me explain how it happens, because understanding this could save your vision. Inside your eye, right where the cornea, the clear front window, meets the iris, the colored part, there's a tiny drainage channel called the angle. Think of it like a sink drain. Fluid is constantly being produced inside your eye. It's called aqueous humor, and it needs to drain out through this angle to keep the pressure stable. As long as that drain stays open, everything works perfectly. But in some people, especially older adults, people who are farsighted, and people of Asian descent, this drainage angle is naturally narrow. It's like having a sink with a drain that's already partially clogged. It works fine most of the time, but if something blocks it even a little bit more, the whole system backs up. Here's where anticholinergic drugs become dangerous. These drugs cause your pupil to dilate to get bigger. When your pupil dilates, the iris, the colored ring around your pupil, bunches up like a curtain being pulled to the side. In people with narrow angles, that bunched up iris can physically block the drainage channel. It's like shoving a cork into a bottle. Fluid keeps being produced, but it can't escape. The pressure inside your eye starts climbing, fast. Within a few hours, it can skyrocket from a normal 12 to 15 millimeters of mercury to 40, 50, even 60 or higher. Your eye becomes rock hard, like an overinflated basketball. The pressure crushes the delicate structures inside your eye, cutting off blood flow to the optic nerve. The pain is excruciating. It's not like a headache. It's a deep, throbbing, unrelenting agony that makes you nauseous. Your vision becomes foggy and blurred. You might see halos or rainbows around lights. And if it's not treated within 12 to 24 hours with emergency laser surgery or medication to open that drainage angle, the optic nerve dies. The blindness is permanent. According to the FDA and the American Academy of Ophthalmology, acute angle closure glaucoma is one of the few true ophthalmic emergencies. It's preventable, but only if you know you're at risk. Here's the tragedy. This is 100% preventable. If you're over 60, especially if you're farsighted. If you've been told you have shallow anterior chambers or narrow angles, or if you're of Asian descent, you should avoid anticholinergic drugs unless absolutely necessary. And even then, you should only take them under close supervision. But here's the good news. Your eye doctor can check your drainage angles at about 5 minutes using a simple test called gonioscopy. They shine a light into your eye and look at the angle with a special lens. If your angles are narrow, they can perform a quick, painless laser procedure called a laser peripheral iridotomy. They make a tiny hole in your iris, like creating a pressure relief valve that permanently prevents angle closure glaucoma. The procedure takes 10 minutes. You go home the same day. And you're protected for life. David was lucky. We gave him emergency medications to bring his pressure down, and the next day, we performed a laser iridotomy. His vision was saved. But so many people aren't that lucky. They take a Benadryl for allergies, or they start an antidepressant, and they have no idea they're walking into a trap. So if you're over 60, ask your eye doctor at your next visit, do I have narrow angles? Am I at risk for angle closure glaucoma? It's a simple question that could save your sight. But here's where things get even more concerning. There's a class of drugs that's exploding in popularity right now. Drugs that millions of people are taking for weight loss and diabetes. And new research published just last year has linked them to a sudden, irreversible form of blindness that's shocking even the medical community. Now here's where this story takes a turn that most men would never see coming. We need to talk about two categories of drugs that millions of men use and how they can trigger sudden, permanent blindness overnight. Let's start with something most men never connect to vision: erectile dysfunction medications and the blockbuster weight loss drugs that are taking over the world right now. Drugs like Viagra, Cialis, and Levitra work by increasing blood flow not just to the penis, but throughout your entire body, including your eyes. And the new weight loss drugs, Ozempic, Wegovy, Mounjaro, they're revolutionizing diabetes care and helping millions of people lose weight. For most people, these drugs are safe, life-changing even. But for certain men with underlying conditions they don't even know they have, these drugs can trigger what we call an eye stroke, a catastrophic blockage that causes permanent blindness in a matter of hours. Let me tell you about Tom. He's 58, successful businessman, been battling weight and blood sugar issues for years. His doctor put him on Ozempic 6 months ago. His A1C dropped, he lost 30 pounds, he felt amazing. One Saturday night, he took Viagra before bed. Sunday morning, he woke up and couldn't see out of his left eye. Not blurry, not foggy, just a massive black spot right in the center of his vision, like someone had taken a magic marker and blacked out half the world. He rushed to my office Monday morning, terrified. When I examined him, I found exactly what I feared: NAIN, non-arteritic anterior ischemic optic neuropathy. It's often called an eye stroke, and it's one of the most devastating forms of sudden vision loss in adults over 50. Here's what happened to Tom, and why you need to understand this. Your optic nerve, the cable connecting your eye to your brain, needs constant blood flow to survive. It's fed by tiny blood vessels, thinner than a human hair. In some people, the optic nerve is naturally crowded, meaning the nerve fibers are packed tightly together in a small space, leaving very little room for blood vessels to navigate. Think of it like trying to run water through a garden hose that's been kinked or squeezed. If anything disrupts the flow even for a few hours, the nerve tissue starts dying. Now here's where it gets scary. In July 2024, researchers from Mass Eye and Ear, one of the top eye hospitals in the world, affiliated with Harvard, published a groundbreaking study in JAMA Ophthalmology. They found that people taking semaglutide, the active ingredient in Ozempic and Wegovy, had a dramatically higher risk of developing NAIN. The numbers are shocking. People with diabetes taking semaglutide were 4 times more likely to develop this eye stroke. But people taking it for obesity? They were 7 times more likely. Let that sink in. 7 times. Now before you panic, let me be clear. The overall risk is still rare. Dr. Joseph Rizzo, one of the world's leading neuro-ophthalmologists, estimates it happens in roughly 1 in 10,000 people. But here's the problem: millions of people are now taking these drugs. And when you multiply millions by even a small percentage, you're talking about thousands of people losing their vision. The mechanism is still being studied, but biochemists believe it's not the drug itself that's toxic. It's the speed at which these drugs lower blood sugar. When your blood sugar drops rapidly, it causes osmotic stress shifts in the fluid balance inside your eye. This can exacerbate diabetic retinopathy, cause optic nerve swelling, and in people with crowded optic nerves, it can trigger a blockage. The blood vessels feeding the nerve get compressed. Blood flow stops. The nerve starves. And by the time you wake up, the damage is done. The same mechanism applies to erectile dysfunction drugs. Viagra, Cialis, and Levitra work by dilating blood vessels and increasing blood flow. For most men, this is fine. But for men with pre-existing vascular issues, high blood pressure, diabetes, high cholesterol, or a history of mini-strokes, the sudden surge in blood flow can trigger a blockage in those tiny vessels feeding the optic nerve. The FDA has required warnings about NAIN on e-drug labels for years, but most men never read them. Now here's the even scarier part: blood thinners. If you're taking blood thinners like Coumadin, Eliquis, Xarelto, or even daily aspirin, and you combine that with ED medications or rapid blood sugar changes, you're at risk for retinal hemorrhages. Your retina is like the film in a camera. It's a thin, delicate layer of tissue at the back of your eye that captures images and sends them to your brain. It's fed by the smallest, most fragile blood vessels in your entire body. Blood thinners prevent clots, but they also make you more prone to bleeding. If one of those tiny retinal blood vessels ruptures, blood leaks onto the retina. Suddenly, your vision is distorted, blurred, or completely blocked. In severe cases, the blood can pool under the retina, causing it to detach like wallpaper peeling off a wall. Once the retina detaches, you have hours, maybe a day, to get emergency surgery. If you don't, the vision loss is permanent. I've seen men come in with retinal hemorrhages after taking Viagra while on blood thinners. They thought it was safe because both drugs were prescribed by doctors. But no one told them about the interaction. No one warned them that combining these medications could create a perfect storm in their eyes. So here's what you absolutely must do. If you're taking blood thinners, or if you have any history of retinal issues, vascular disease, diabetes, high blood pressure, or mini strokes, talk to your doctor before using ED medications or starting weight loss drugs like Ozempic. Get a comprehensive eye exam. Have your optic nerves evaluated. Make sure you're not walking into a trap. And here's a rule I give all my patients. If you ever experience sudden vision loss, flashes of light, floaters that look like a swarm of gnats, or a dark curtain coming down over your vision, you have 24 hours to save your sight. Drop everything. Get to an emergency room immediately. Time is everything. Tom's story doesn't have a happy ending. His vision loss was permanent. But if he had known about this risk, if his doctors had communicated with each other, he might still have full vision today. But here's what keeps me up at night. The hidden mistake that causes more blindness than all of these drugs combined. It's something happening in medicine cabinets across America right now, and almost no one is talking about it. Alright, we've covered corticosteroids, blood pressure pills, antihistamines, weight loss drugs, and ED medications. But here's the truth that keeps me up at night. The hidden danger that's causing more vision loss than any single drug I've mentioned. It's not just one medication that's destroying people's sight. It's the combination. Most older adults are taking 5, 10, even 15 medications every single day. Blood pressure pills, diabetes drugs, cholesterol medications, antidepressants, pain relievers, antihistamines, corticosteroids for arthritis, blood thinners to prevent strokes. Each one prescribed by a different doctor, your cardiologist, your rheumatologist, your endocrinologist, your psychiatrist. And here's the terrifying part. None of them may know what the others are prescribing. This is called Polypharmacy, and it's the silent epidemic destroying vision in older adults across America. Let me tell you about Helen. She's 74, a retired nurse sharp as a tack, meticulous about her health. She was taking 12 medications when she walked into my office complaining that her vision had been getting progressively worse over the past year. Dr. Mitchell, I can't see street signs anymore. I had to give up driving last month. It's like everything's covered in a gray fog. When I examined her, I found moderate cataracts and eye pressure at 28, not dangerously high, but definitely elevated. But what really shocked me was when I asked her to bring in her medication list. She handed me a printout with 12 drugs. Prednisone, corticosteroid for rheumatoid arthritis, amlodipine, calcium channel blocker for blood pressure, amitriptyline, antidepressant, also used for nerve pain, Eliquis, blood thinner, metformin, diabetes medication, oxybutynin, bladder control, Benadryl, she took it for sleep a few times a week. Plus 5 more. I sat back in my chair and felt my heart sink. Helen wasn't being careless. She wasn't taking anything she didn't need. Every single medication had been prescribed by a specialist for a legitimate condition. But no one had ever looked at this list from an eye perspective. Here's what was happening inside Helen's eyes, and why this combination was a ticking time bomb. The prednisone was raising her eye pressure and accelerating cataract formation. The amlodipine she took at night was dropping her blood pressure too low during sleep, starving her optic nerve of blood. The amitriptyline and oxybutynin, both anticholinergics, were dilating her pupils and putting stress on her drainage angles. The Eliquis was thinning her blood, increasing her risk of retinal hemorrhage. And the Benadryl she took for sleep, that was adding even more anticholinergic load. Individually, each drug might have been manageable. But together, they were creating overlapping stress on her eyes from every possible angle. One drug raised pressure, another lowered blood flow, a third increased bleeding risk, a fourth dilated the pupil. It was like trying to balance on a tightrope while someone's shaking the rope. blowing wind in your face and throwing weights at you. And here's the tragedy. No one was looking at the big picture. Her cardiologist prescribed the amlodipine and focused on keeping her blood pressure under 130/80ths. Mission accomplished. Her rheumatologist prescribed the prednisone to control her joint inflammation. It worked beautifully. Her psychiatrist prescribed the amitriptyline for nerve pain and depression. She felt better. Her urologist prescribed the oxybutynin for bladder control. Problem solved. But no one asked, what is this combination doing to her eyes? The cardiologist didn't know about the prednisone. The rheumatologist didn't know she was taking anticholinergics. The psychiatrist didn't know she was on blood thinners. And Helen? She assumed her doctors were communicating. She thought that because everything was being managed by specialists at the same hospital system, they were all on the same page. They weren't. This is the reality of modern healthcare. It's fragmented. Specialists are brilliant at treating their specific area, but the system doesn't incentivize or even make it easy for them to look at the whole patient. There's no one quarterback coordinating care. No one asking, how do these 12 drugs interact? What cumulative effects are they having on the eyes, the kidneys, the liver, the brain? And here's the mistake patients make. They assume it's being handled. They trust that someone, somewhere, is looking at the full picture. But most of the time, no one is. According to research published in the Journal of the American Geriatric Society, nearly 40% of adults over 65 are taking 5 or more medications simultaneously. And studies show that the risk of adverse drug interactions, including vision-threatening effects, increases exponentially with each additional medication. But here's what makes this even more dangerous. By the time you feel something wrong with your vision, the damage is often irreversible. Glaucoma doesn't hurt. Cataracts develop slowly. Optic nerve damage happens silently. Retinal changes creep up on you. You don't wake up one day and suddenly realize you're losing your sight. It happens gradually, so gradually that your brain compensates, and you don't even notice until you've lost 30%, 40%, even 50% of your vision. So here's what you absolutely must do, and I cannot stress this enough. Create a master medication list. Write down every prescription medication, every over-the-counter drug, every supplement, every vitamin. Include the dose, how often you take it, and which doctor prescribed it. Update it every time something changes. Bring that list to your eye doctor at least once a year, even if your vision feels fine. Tell them, I want you to review my medications and tell me if any of them could be affecting my eyes. Most eye doctors will gladly do this. It takes 5 minutes, and it could save your sight. Ask your primary care doctor to do a medication reconciliation. This is a fancy term for let's sit down and review everything you're taking to see if there are any dangerous interactions or unnecessary duplications. If you don't have a primary care doctor coordinating your care, find one. You need a quarterback. Never assume your doctors are talking to each other. In an ideal world, they would be. But we don't live in an ideal world. Electronic medical records help, but they're not foolproof. You have to be your own advocate. Helen's story has a hopeful twist. We adjusted her medications, switched her blood pressure pill to a morning dose, worked with her rheumatologist to lower her prednisone dose, replaced her anticholinergic drugs with alternatives that don't affect the eyes. Within 6 months, her eye pressure dropped, her cataracts stabilized, and her vision improved. She's driving again. But so many people aren't that lucky. They lose their vision because no one connected the dots. Because the system failed them. Because they didn't know they needed to ask. Your eyes are not separate from the rest of your body. They're connected to your heart, your brain, your blood vessels, your immune system. The drugs you take for your heart affect your eyes. The drugs you take for your joints affect your eyes. The drugs you take for your mood, your bladder, your sleep, they all affect your eyes. Don't let yourself become another statistic. Take control. Ask questions. Demand answers. Your sight is worth fighting for. Listen, I'm not here to scare you. I'm here to empower you. Vision loss is not an inevitable part of aging. It's not something you just have to accept. Yes, certain medications carry risks, but knowledge is your greatest weapon. If you take corticosteroids, get your eye pressure checked every few months. If you take blood pressure medication at night, talk to your doctor about switching to morning doses. If you're over 60 and take anticholinergic drugs, get your drainage angles checked. If you're on blood thinners or ED medications, have a retinal exam. And no matter what, bring your full medication list to every eye appointment. Your vision is precious. It's how you see your grandchildren's faces. It's how you read, drive, stay independent. Losing it doesn't just affect your eyes, it affects your entire quality of life, your mental health, your survival. So here's my challenge to you. Don't wait until you notice a problem. Be proactive. Schedule an eye exam. Ask questions. Advocate for yourself. Your doctors are brilliant, but they're human. They can't protect what they don't know is at risk. If this video saved you or someone you love, please share it. Leave a comment below telling me which medication you're taking. I read every single one. And subscribe to this channel, because I'm going to keep exposing the hidden dangers your doctors might not mention. Your sight is worth fighting for. Let's protect it together.